So regarding quality of life after CAR T, the thing is we cannot say much already about the quality of life after CAR T treatment as we don't have enough data yet. It's a new treatment, we're just out of the clinical trials and they're being reimbursed slowly in various countries. So we need to capture more data on the quality of life. So it's very important to implement the patient-reported outcomes so that they will be used in clinical trials, but also that they are implemented in daily practice. So capture the data is one thing. What we also see is regarding quality of life is that it doesn't start after a treatment. It actually starts already during the treatment. And we see the more that people are being cared of and that they have a group, the more they support the experience, not only from the caregivers and family members, but also from a very great nursing team, is that they can deal with things like side effects and long-term effects much better. We see that the outcome in the end is better. So to really enhance the quality of life, it already starts early during the treatment. Because part of quality of life is that not only your body gives up, it's like a domino game. So when you experience a very severe disease, it's your health is deteriorating, but it has an impact on your social network, your work environment. It has a financial burden that all has to be captured. So after treatment, you have to deal with all those things again. Now, CAR T is for many people, it's not available yet. So there is a financial burden if people want to have this treatment, and that can cause worry, and worry can cause distress, and that's where, for example, quality of life indication will not be very high. People do express they don't sleep well, they have depression. The chance, not all of the patients, of course. Usually patients are quite pragmatic and know exactly they know where they stand. But still, two things about that is there are several things that have an impact on quality of life, like financial burden, having support, losing a job, and that all needs to be taken care of. So to say again, for CAR T, that's the financial burden. It also relates to side effects and long-term effects, but we don't know yet all what they are. And of course, the adverse effects, neurotoxicity is really, has an impact with CAR T, but the long-term effects, unfortunately, we do not know that, and we need to capture that. So I really think that it's very important to, again, implement the patient-reported outcomes, take care of patients during when they're in the hospital. So make sure there's a qualified psychologist on your staff so patients can deal with existential questions that they're facing, because they are complex, because they're about to lose their life. So they have issues regarding life and death. So a good staff, good support, good reimbursement, and I think that we'll have a very good, clear, concise information, honest information, so we have realistic expectations of CAR T.